Breaking news out of Central Africa. The Democratic Republic of Congo has declared a new Ebola outbreak. Already, more than a dozen people have died, and experts warn the number could rise quickly. If you're in the US, you might be thinking, why should I care about an outbreak thousands of miles away? Well, stick with me, because history shows these events can ripple far beyond Africa. Officials confirmed the outbreak in Kasai province, in the town of Bulape. The first confirmed patient was a 34-year-old pregnant woman who showed hemorrhagic fever symptoms. She died within hours of hospital admission. Since then, at least 15 people have died out of 28 suspected cases, including 4 health workers. Lab tests confirm it's the most dangerous strain, the Zaire variant, the same strain behind some of the deadliest Ebola epidemics in history. Congo's health minister says the current fatality rate is over 50%, which underscores how serious this outbreak already is. Ebola is one of the most feared viruses because it spreads through direct contact with bodily fluids, blood, vomit, semen, or contaminated objects like bedding. Symptoms start with fever, muscle pain, and vomiting. In severe cases, it leads to internal and external bleeding and organ failure. Unlike COVID, Ebola isn't airborne, but outbreaks are still hard to control because once someone is infected, it spreads quickly in close contact settings, like households, hospitals, and funerals. This is Congo's 16th Ebola outbreak. The last major one in eastern Congo between 2018 and 2020 killed more than 1,000 people, and the deadliest Ebola epidemic ever, in West Africa between 2014 and 2016, killed over 11,000. Right now, the situation is complicated by 2 big challenges. Armed conflict in eastern Congo is making health responses more difficult. Cuts in U.S. aid have weakened an already fragile health system, leaving fewer resources to fight outbreaks. The World Health Organization warns case numbers will likely rise, and local doctors say people fleeing villages out of fear are making it harder to trace and contain infections. To fight the spread, Congo and international partners are moving fast. The WHO has dispatched experts and supplies, protective gear, mobile labs, and medicines. Congo still has stockpiles of the Ervebo vaccine, which has proven effective in past outbreaks. Authorities have imposed partial lockdowns in affected areas, schools closed, markets suspended, and public gatherings restricted. But doctors say the biggest challenges are shortages of protective equipment, trained personnel, and medicine. One local health official told the AP, "Our hospitals need urgent supplies if we are to control this epidemic." So why should Americans care? Global health is interconnected. Remember, Ebola cases have reached the U.S. before, in 2014, when travelers brought the virus to Texas and New York. With international travel, outbreaks can cross borders quickly. And even if it never reaches U.S. soil, instability in Africa impacts global trade, humanitarian aid, and security. In other words, an outbreak in Congo is not just Congo's problem, it's the world's problem. Here's the bottom line. Congo's new Ebola outbreak is still small, but it's deadly, and officials fear it could grow. The world has better tools than ever: vaccines, mobile labs, and faster response teams. But without support, fragile health systems can easily be overwhelmed. For Americans, this is a reminder. Global health crises don't respect borders. Staying informed, supporting international aid, and learning from past mistakes are key to keeping all of us safe. I'm your name. Thanks for watching. Hit like and subscribe for more global updates, and let me know in the comments. Do you think the US should be doing more to support countries fighting outbreaks like this?